Teaching video to remove staples. Check doctor's orders. Wash hands when you enter the room. Introduce yourself to your patient.
Hi, my name's Tiana, your student practical nurse.
Identify patient using 2 identifiers.
Can I get your name and date of birth?
Explain procedure to the patient.
I'm just going to remove your staples today.
Gather equipment. Suture staple removal kit, steri strips, antiseptic swabs, and gloves. Assess patient for pain.
Are you having any pain at all? Okay.
Provide privacy. Raise the bed to working level. Perform hand hygiene. Position patient and expose the wound. Open suture removal kit and don gloves. Remove dressing, assessing wound, and looking at old dressing for any drainage. Clean sutures with antiseptic swabs. Place lower tips of staple extractor under first staple. As you close the handles, upper tip of the extractor depresses the center of the staple, causing both ends of the staple to be bent upward and simultaneously exit their insertion site in dermal layer. As soon as both ends of staple are visible, move it away from the skin surface. Release handles of the staple extractor, allowing staples to drop into the garbage. Repeat until every other staple is removed. Assess wound for healing. If healing well and doctor's order states to remove all, repeat steps until all sutures or staples are out. Place steri strips in order, if ordered, or if any separation greater than 2 sutures or staple occurs. If not healing well, stop and notify physician. Assess site where removed. Document time, number of staples removed, cleaning of the suture line, appearance of the wound, type of dressing applied if required, and the patient's tolerance to the procedure. Remove gloves. Wash your hands. Cover the patient. Lower the bed. Be sure the rails are up and call bell is in reach. And don't forget your 4 P's: pain, potty, position, possessions. Teaching video for wound packing and irrigation. Check doctor's orders for directions on wound care and dressing change. Check nursing notes to see what prior dressing change was like to determine necessary supplies, pain, drainage, etc. Perform hand hygiene when entering the room. Introduce yourself to the patient.
Hello, my name's Courtney. I'm going to be your student practical nurse for today.
Identify patient using 2 identifiers.
Can you tell me your name and date of birth, please? Perfect.
Explain the procedure to your patient and ask permission.
Mrs. Walker, we're just going to be changing your dressing today. Is that okay? Great, thank you.
Perform hand hygiene and gather your supplies. Clean gloves, tape, dressing tray, extra sterile gauze, 2x2s or 4x4s, sterile normal saline solution, sterile gloves, solution for irrigation, a syringe, PPE as required, blue pads, kidney basin, sterile cotton swab, and a measuring device. Ask the patient about pain.
Are you having any pain today, Mrs. Walker? No? Great.
Assess for allergies to latex, iodine, and shellfish.
None? Perfect.
Provide privacy. Raise the bed to working height. Clean off bedside table so you can work, and arrange your bedside table at waist height. Always be sure that you do not turn your back to your sterile field. Arrange garbage disposal away from the sterile field. Position and drape patient as necessary. Patient should be positioned to permit gravitational flow of solution. Place blue pad under the area where irrigating. Wash your hands and don clean gloves. Pull off the tape toward the wound while stabilizing the skin with the other hand. Remove the old dressing. Assess the dressing for any drainage and place it in the garbage. Be sure to take note of exudate, odor, the type of dressing that you've removed. Inspect the wound, noting the degree of healing, presence of pus and necrosis, the size, check for odor, drainage, and condition of sutures, if there is any. Measure the wound. You're measuring the width and the depth. Once the wound has been measured, remove gloves properly and discard them. And perform hand hygiene. Open sterile dressing tray at waist height. Open the flaps of your sterile dressing tray distal, lateral, and proximal. Maintain a sterile field. Arrange your forceps tips down, standing on the tray, or close to the 1-inch border. Maintain sterility of your forceps throughout the entire dressing change. Identify if you break your sterile field at any time and make corrections. Place sterile drape beside the incision or under the wound if needed, or discard. Open sterile gauze and place on sterile dressing tray. Add syringe irrigation supplies to your sterile field. Be sure to check the expiry date of your sterile solution being used, as well as whether or not the solution is the right one that was ordered. Open sterile saline. Placing cap face side up if you put it down. Lip your solution into the garbage can if the bottle has already been used with the label facing your palm. Pour sterile saline into the tray. Do not touch the edges of the tray or splash saline on the tray or your sterile field. Don sterile gloves. Be sure to wash your hands first before donning your sterile gloves. Hold tip 2.5 centimeters above upper end of wound and over area being cleansed. Irrigate using continuous pressure. Flush wound. Repeat until cleansed. Dry wound edges with gauze. Pack wound as ordered. It should be loose and should fill the wound with packing material and only until it reaches the wound surface. Place sterile gauze on the incision or the wound and cover it without rearranging the dressing or contaminating, as ordered. Remember not to turn your back to your sterile field. Apply abdominal pad if needed. Tape dressing, being sure not to use too much tape. At this point, you do not need your sterile gloves, so you can remove them properly. Be sure to put a piece of tape on the wound that indicates the date, time, and initials on the dressing and when it was changed. Clean your area. Wash your hands. Arrange patient for comfort, ensuring his call bell is in reach, bed is in low position, and rails are up if required.
Are you comfortable, Mrs. Walker? Great.
Open your curtain. Be sure to address your 4 P's: potty, pain, position, and possession. Discard the dressing tray in the garbage, placing the forceps and the sharps container. Once that is done, wash your hands. Document drainage on the dressing removed, solution and irrigation device used, drainage appearance, peri-wound appearance, dressing applied, and how the patient tolerated.